Today on Lean and Green Healthcare, I'm joined by Sudhir Rathore, a seasoned entrepreneur and healthcare consultant, widely recognized among the top 1% of executives who are shaping Nigerian healthcare. Sudhir's career spans leadership roles as country manager for Nigeria at Fortis and Aster Healthcare, followed by founding Troika Consulting, a firm helping hospitals optimize operations and profitability. And then Surjen, health tech platform transforming how patients connect to care in Nigeria. Most recently, Sudhir has co-founded a boutique specialty hospital called the Cardiac Clinic in Abuja in Nigeria, dedicated to pediatric cardiology and cardiac surgery, making advanced heart care accessible within Nigeria. In this episode, we'll dive into his strategic vision for a self-sustaining African healthcare model, the critical role of smart investment, and how entrepreneurs like him are building a future where quality care is both accessible and profitable. Thank you so much, Sudhir, for being on the show today. It's a pleasure having you, and I'm super excited about the discussion we're going to have.
Thank you, JB, for inviting me here, and me too also super excited to discuss further in this, right?
So maybe, Sudhir, I've been following you for a bit on LinkedIn, and actually I'm very interested in what you're doing, having both lived in West Africa and East Africa. So I've seen also the reality in the field, and I've seen the healthcare landscape evolve also over time in those regions. So maybe it would be interesting if you could walk us through your professional journey, just shortly, like understanding if you landed in Nigeria or if you grew up there, and from Fortis and Aster to now being a full-time entrepreneur with your own ventures.
Thank you, JB. So I came here around 22 years back. That was way back in 2003, and as a kind of a person working for some supermarket chains as a manager. But later on, I came back with Fortis as a country manager to develop their medical tourism business, and that I have continued for 2 years. And then after that, I joined another hospital on ground in Abuja, which was Primus Hospital. Between 14 and 16, I have been working with Aster Healthcare, which is based out of Dubai. And that was also to develop their medical tourism business. And it was like how many years? Like 6 years I worked with these hospitals, developing their medical tourism business, various partnerships in Nigeria. But then I thought that it's high time that we must give back to Nigeria, because this is a country wherein the population is growing, healthcare is not in that good shape, and the whole idea of providing the value and accessibility to the procedures which we are sending the patients to India or Dubai must be available here. So that was the whole thought behind starting the entrepreneurial journey.
Okay, so maybe, can you help us understand how you shifted from those very established groups? You probably had a good salary and everything, to like being an entrepreneur. How did you make that switch? How did you start at the initial stage, basically?
Yeah, I would say that it was not an easy kind of start. That time I was at the age of 35, 40, and then I had young kids. My family was here in Abuja with a good salary, of course, with working with the international hospitals and all that. So it was not a good. It was a very high risky thought to get into the entrepreneurship. But I saw a value which I can create in this country, and I also saw that I will be eventually elevated from a person working with a company to an entrepreneur, which can do better things. Because when you're working with a company, you have a lot of limitations, and you cannot explore the opportunities which may come along the way. So I thought it is better for me to try, because if this is not the time, then when? So I thought, let me just put down my papers, and I said that this is it. I want to go and explore the opportunities we have in the country, and let me see what I can do. And it's been like 9 years now, and the journey has been good.
So when you started with the consulting business, correct?
Right, because Troika Consulting was formed in 2012 while I was already working with these hospitals, thinking that maybe one fine day I may end up consulting to businesses which are on ground, because I have gained that kind of knowledge on especially the operational efficiencies, the revenue generations, and cutting the those gaps which most of these local hospitals encounter on their way to the profitability. So I have started with Troika Consulting, and we have consulted a lot of hospitals. That includes Ministry of Health for Nigeria a couple of times, and it was good, great. We have helped these hospitals from coming from loss making to profitable, more profitable.
Okay.
In fact, double their revenues and all that. So we have also established a university teaching hospital with an investment of $29 million and all. So we have done good work with a couple of clients in Abuja. So
Okay.
that's what the journey in Troika Consulting. We are still doing that.
Yeah. I'm seeing the evolution of the landscape there. Some huge medical centers being established in Nigeria. I actually have some good friends located there. And I'm impressed by the risk that you took, knowing, okay, Nigeria, how long ago was that? That was
I came here in 2003. That was 18th of
so.
April.
So it was high risk, and
Yeah, it is.
you have stayed there with your entire family. So really impressive. So maybe can you help us understand the shift from consulting those large hospitals that have some very unique challenges with now being more onto two fronts: the health tech space and the investment and hospital setup. Because now you have become also into the actual operations of kind of a tertiary hospital, boutique hospital concept. So why this shift, and what were you looking to address in terms of gap in the ecosystem?
So the idea of Surgeon Healthcare is predominantly a patient concierge service, which is online and digital. Came around 2011 and 12 when I was working with Fortis, because digital healthcare was growing in India, and always whatever happens in the Indian healthcare system always impacts people like us who have been traveling around the world. So I was thinking that we can do something of that sort in Nigeria, because Nigeria always comes out to be an opportunity wherein things always come late, maybe after a decade or so, especially in terms of the digital, whether it is fintech or health tech or whatever we talk about. So the idea was long back, but we started this thing in the midst of COVID, when we saw that everything is at a standstill. People are not able to move out, not able to go to the hospital, even if they are reaching to the hospitals. The hospitals are denying them admissions because of the fear of the COVID and all that. So we said, let's quickly start something which can help the patients to, kind of consult online. And that was the start of this thing. And when the COVID testing was done mandatory by the governments for both the Nigeria, India, and other countries, then it was very important for us to help these people, those who are travelers, to process their, COVID samples as soon as possible. That was also an opportunity for us to grow faster. So what we did is that we hired a team of phlebotomists. A couple of them went around all the states in Nigeria and started collecting the samples of COVID. While those days the COVID sample was used to take around 48 hours to process, we reduced it to 6 hours, and then later on to 3 hours. Sorry, the 4 hours. So that was our kind of far more advantageous
So
solution as compared to the laboratories.
you went from the fully digital to now being also
Yeah,
present and physically active into the operations.
physically active
Can
on
you
ground. Yeah.
can you just help me understand on the online consultation part? You were onboarding local doctors based in
Right.
Nigeria,
Right.
and what was the business model? Because I'm guessing there are cash patients, then you have insurance patients. How was it working basically?
So basically, we had a couple of doctors who were enrolled on our platform, and all sort of cases except the super specialty cases. Basically, the primary cases we were handling online. So assuming a patient wants to call us, they will do the payment online through our website. Payment gateway is there, and then they book the appointment. Once they book the appointment, the doctor is available at this end. So they can do through an application or WhatsApp video call. So these were two or three applications are available for the patients. We are still doing that, but now we have kind of moved away from that to more of a patient referral services. So, but that time
Okay.
it was booming, and we have really taken advantage of it.
And the patients were trusting the platform to pay online and think that they will get an immediate meeting. Like I know, I mean, in West and in East Africa, there is a big trust issue. People, they have been scammed by so many startups, so many companies that have started, and then you pay and that's it. It doesn't go through. So
So we are basically, we have a registered office in Abuja. We have an address. Anybody can come and visit us. That was since the beginning. Okay, we are
Okay.
kind of accredited by the local regulatory authorities, just like a hospital is
Yeah.
registered in a local environment or local municipal corporation. We are also registered as an application.
Okay.
So everything is regulated here. You cannot just ditch anybody.
Correct.
Regarding the payment and all that, we use Paystack, which is one of the largest
Yes.
payment gateway in Nigeria. We are also, we build that trust. We spend a lot of money on our website and all that. So we made sure that we choose the right kind of APIs, the right kind of vendors, so that the trust is built among the patients. To prove that, let me tell you that American Embassy, USAID, CSC, the CDC, and most of the major embassies, the banks, the corporate houses in Nigeria were our clients.
Yeah.
Yeah.
Yeah. Yeah.
So that trust was there.
There was a similar startup. They have shifted now. They made good money during COVID on testing and online consultation, but then it went down. Like when the demand goes down and this is your primary source of revenue,
I think
then you need
that
to.
was Gene 54 you're talking about.
No, this one I followed. No, I can't remember the name. It was in Ivory Coast. I was based in Ivory Coast.
Okay.
So it was another, it was more of home care, like home care startup doing the at-home testing, the online consultations. But then, of course, when the COVID went away, then they had to find some other businesses. Okay, and now with with the boutique hospital, I'm guessing you have understood that there is actually a big gap also in the actual care of patients and at the infrastructure level. So, what is exactly the the positioning of a boutique hospital? Can you explain us?
So this is very interesting business model which we are following since last 1 year. Not actually last 1 year. I would say it's like last 3 years. I was visiting various hospitals because most of my business, whether you're talking about Troika Consulting or Surgeon Healthcare or even the cardiac clinic, my daily work is that going to the hospital, meeting to the doctors, discussing various things and all that, depending on case-to-case basis. So when I visited most of these hospitals, especially those hospitals which were like a single doctor-owned hospital, small hospital, 15 to 20 bed, 50 bed hospitals, I saw one major issue with these hospitals, especially with those doctors who are aging. So assuming a doctor has started a hospital 20 years back, when he was 50 or something, now he's 70-year-old. His second generation, maybe the son or the daughters, are moved out of the country, maybe in Ireland or UK or Germany, wherever they are, and they do not want to come back. That is one thing. Even if they are doctors, they do not want to. Now, these doctors are growing old. They cannot handle the marketing. They cannot reach out to the corporates. They cannot reach out to the insurance. So, the business growth is either stagnant or even degrowing. This is a situation wherein they have built a hospital, they have a hospital,
Yes.
they are working there, but they do not make money out of that. And I have seen such kind of hospital around 30 to 40 hospitals. So I said, what we can do about them. So that was like since last 3 years. Last year I came across one of my the co-founder of cardiac clinic, Professor Elijah Miner. He's a general surgeon of repute. So I discussed with him and I said that what if we can take over these hospitals, renovate them, put the right kind of equipments and relaunch them. So this will help these doctors because then they can peacefully retire and also get more money out of their facilities. And also we will grow our brand under a single umbrella wherein you can have 20 different hospitals with 20 beds accommodating 400 to 500 beds across Nigeria, of course with different specialities. So he said that this is a great idea, and then what we did is that this hospital, the cardiac clinic, is first of that model. So this was a defunct hospital, a general pediatric hospital. So we have taken over that hospital, renovated it. I will show you the pictures of the previous and post, and you will be amazed to see what we have done. We have put in the right kind of equipment. We have built a very standard ICU, and then you know what? We are going to do open heart surgeries for pediatric cases, those congenital cases. This is not happening in Nigeria at this point of time, except some large hospitals that do every 2 months or 3 months. So we want to do it on ground every time. Whenever the patient is there, we will be able to do that. So this is what we are building. This is something which is very high end, but for a very small hospital.
Okay.
The next facility which we have already identified, we are negotiating, will be more of a urology and maybe a transplant center. So this is how we are going to take over hospitals one by one and then build that particular hospital as a particular niche facility. So this will be more of a pediatric and adult cardiac center. The other will be a urology, maybe a transplant center. The next will be gynecology and another pediatric. Every facility will have its own niche apart from the support services and the other specialties we can join with them. So this is.
And let's just go back to the business model. Do you let the main doctor who has the license and who has been running that hospital, do you keep him as a shareholder and you work on a revenue or profit sharing model with him? Or do you purchase completely the entire equity, the entire shareholding from him?
Okay, so we are not working on one single particular model. Every time when we reach out to the facility owner, we discuss with him whether he wants to be a part in the operations, whether he wants to sit aside and let us run the hospital, whether he wants to be the owner and getting only the rental value of the facility, or he wants to sell it outrightly. So depending on the case to case basis, like this particular thing, the cardiac clinic is more of like fully owned by us, and we are paying a lump sum amount for the rental value of that. But at the same time, we have also recruited or hired the owner as one of our main doctors. So she is getting, kind of a revenue generated through her consultations and a salary and all sorts of things, and also the rental value. So her profitability doubled what she was not able to do herself. So for her, it's a win-win situation.
And what are the criteria that you're looking at? Let's say a checklist, an operational checklist. Just give us an overview of what makes a center viable according to your thesis for profitability and sustainability on the long run.
Okay, so for us, a good facility depends on various things like the location of the facility. Okay, right now we are looking forward to these facilities which are in the major cities like Lagos, Abuja, Port Harcourt, Enugu, those Kano, major cities. Because we want to start with something which can quickly turn around and build the revenue base. The second is that the ownership. What is the ownership structure? How many owners are there? So that then if single owner is there, it is perfect because we don't have to do the negotiation with a lot of people. Okay. The third is that what is the issue? Why the hospital is not working? Is it an operational issue or it is a regulatory issue? If it is an operational issue, very good, we can take over. If it is a regulatory issue, what kind of regulatory issue is there? Whether we will be able to sort it out or not. If not, then we will not touch that one. Okay, so these are basic things. Then we will see the catchment area. We'll do the forensic auditing of the infrastructure, the equipment, revenues in last 5 years. A lot of things get involved after that. But these are 4-5 fundamental basics on which we generally, seek the hospital.
Okay, and how long does it take? I mean, I'm guessing it differs based on case to case, but can you let me explain, let me understand like how long it took to take from zero, like the initial discussions, to fully operating a boutique hospital?
So I won't time the initial discussions because the initial discussions can be 1 week, 1 month, 1 year or anything. So let's do the calculation after the agreement is signed. So after the agreement is signed, we take 6 months to renovate and relaunch.
But the agreement is signed after you have done your due diligence as well.
Yes.
On the hospital.
Yes. So once agreement is signed based on the basic, whatever we have agreed, everything due diligence, the auditing and everything is done before the agreement. Agreement is signed that means that the hospital has been handed over to us. From there to the launch is 6 months timeline.
And in terms of due diligence, is it just your internal team, or do you hire external consultants for, let's say, some financial aspects, some legal aspects? How do you secure yourself as an investor? And in the future, as you're going to bring also external investors into this business, how do you make sure everything is bulletproof?
Okay, so I myself is a consultant, so most of the things are looked after by me. Okay, regarding the legal, the due diligence of their documents and everything, we have right kind of people in the administration who does that for us.
Okay, so now you would say for an external investor who is, it could be foreign or local, and who wants to make returns and an impact in Nigeria, Usually people think about, okay, let me buy, some regular standard businesses, like I'm gonna buy small shops, I'm gonna buy a clothing store, a barber shop or things like that. And then they have their main full-time job. Let's say they are a banker or lawyer or something. What can you tell them about this specific concept and why they should not be afraid? They should be more interested about it than they are today.
Right. See, Nigeria is an emerging market. The healthcare, as per the reports available, is growing at the rate of 16 to 17% per year. But what I see is, especially in these small hospitals, I have seen hospitals, turning from one hospital to two or four within 3 to 4 years. So we are looking forward to 25 to 30% year-on-year growth in the hospital, especially in the small hospital segment. Even if we don't do much, we are a very kind of average operational team. Even if we don't do much, we are still growing at the rate of between 16 to 20%. So it's a very good industry to invest in. Secondly, Nigeria is going to be 450 million people in 2045. It will be the third largest country in the world, okay, after India, China. So we are looking at a population wherein the facilities, especially the healthcare facilities, will be needed. So who's going to provide? The government is not going to provide this kind of facility, because no government can double their healthcare facilities in 20 years' time. No government, even the best of the best governments, they cannot do it. So there is a possibility of the private healthcare players to come in and play their part. This is what I understand. So I am one of them. I'm playing my part. So I see a huge opportunity in terms of the growth and also the return on investment.
I get that. So today, the boutique hospital that you have is mostly owned by you and your partner. So
Yes.
how does the evolution of your business look like in terms of, do you have specific targets in mind of how many hospitals you want to open, how much capital is needed, what is like an investment thesis kind of, and what are you offering? Is it like a standard package, like minimum ticket size to someone who wants to invest with guaranteed return? How does it look like?
So the basic hospital generally happens to be a major investment, especially in its infrastructure. In fact, it is called as a capital intensive at both the
Yes.
levels, at the infrastructure level and also for the team. You are hiring the doctors who are highly qualified. You pay them a lot of money and all. But what we are doing here is that we are looking forward to having around 10 or 12 hospitals within next 2 years. And we are looking forward to between $2 to $3 million. That means we are investing around 200 to $250,000 per hospital for renovation, for equipping it, and then hiring a team for and the initial capital. And I think nothing can be done below this amount. And since we have already done this thing, we know how it is done. This is the money which we have spent to renovate this hospital, hire the team. The team is already hired. The hospital is already renovated. We are waiting for the approval which we can get in next 15 days time or so, and we will start our surgeries. Yeah, this is how.
And I'm guessing your plan is to leverage technology to centralize the operations, cut down on the cost. Maybe can you help us understand like how you have done it in your previous ventures, how it has changed now, whether it is the HIS, the patient experience solutions for booking, scheduling appointments, electronic health records, all of that.
So most of the hospitals, these kind of hospitals, I mean, I'm not talking about all the hospitals, but the hospitals which we are targeting generally have all this manual filing system and all that. And you know what happens with this manual filing system? And the operations get, delayed, things follow up on the payments and all that. What we have done is that the first thing which was in our mind is to digitize every process in the hospital. So for us, our hospital will be all paperless. One thing. Secondly, we will have all the vendors, everybody registered on our platform. Okay, so it is a paperless. All the ordering will be a digital ordering. That means you don't have to call anybody. It will be an automated inventory management and everything. It helps us in cutting the cost on going for manual. Secondly, we can have a lean team. That means we don't have to hire a lot of people to do the same thing. Redundancy has to be cut down significantly. Otherwise, the hospital generally have more people working in them and less patients. We want to turn it around. We should have more patients and less people, but highly efficient service standards. So this is the whole idea. And I think technology can significantly do that one, especially since last 2 years, you can see an AI enrollment in healthcare, my God, this is coming out to be really, really, really good. Especially in diagnosis, AI is doing wonderful jobs with algorithms identifying the radiology reports, the scans, and everything. They are doing very good job. So I think
Yeah.
we are at a forefront wherein technology is going to help us make ourselves lean, clean, and of course much more efficient in terms of the service delivery.
Okay. So maybe I think we are coming to an end for our discussion because I'm trying to keep the episodes about the same time. If you had one practical piece of advice on profitability that you would like to leave to a hospital owner, maybe, what would it be? And then I have a follow-up question, but more for the investors that you are looking to attract into your venture.
So I think if the idea about having a hospital in Nigeria is not to have a $300 million invested and building a 500 bed hospital, because somehow I have seen the large hospitals struggle because they have huge overheads, they have things to do which a smaller hospital doesn't have to at the end of the day, and they can still provide far more better quality. Like I have seen bigger hospital who doesn't do major surgeries like the open heart surgeries or organ transplants or kind of high-end neurosurgery, but the smaller hospitals are doing those high-end surgeries and much more profitable. So for me, I think let them invest in the value and the quality a hospital can deliver rather than a flashy building. That is what is I understand, and I think they should also understand. Let them deliver the quality so that we can save that kind of money. $1 billion is estimated to be going out of Nigeria on the medical tourism. I think we can save that money by having multiple hospitals at various locations but delivering quality. Like even if it is 10, 15, 20 bed, if it is delivering quality, I think this is good. We don't have to do much beyond that.
All right, Sudhir, and maybe one way to invite investors or owners to get in touch with you and know more about what you do, where can they follow you?
It's very simple. They can follow me on LinkedIn. I am kind of active on LinkedIn, even if it is not fully active, but I'm partially active. I keep on posting some of the other things, mostly the healthcare system, about the healthcare system in Nigeria. So they can DM me or reach out to me. I'm always available.
I'm going to put your profile in the description. Thank you, Sudhir. Thank you for all the details and explanations. It was very interesting. Thank you.
Thank you, JB, for having me here. It was a pleasure talking.